We think of pre-COVID as the good old days at this point, but in retrospect, there's always been pressures on the system. The COVID crisis really did shine a light on all of those pressures. Literally overnight, we were told that we couldn't see patients in person. We had to go to virtual care to keep everybody safe. It's very hard to deliver a lot of healthcare through virtual means. Now, I mean, there have been some benefits in terms of accessibility as well for through virtual healthcare that came out through the pandemic. So I don't want to minimize those, but it was a very challenging time. The other thing was elective surgeries were immediately halted. Elective procedures were immediately halted. And in medical terms, elective means not emergent, not urgent. It doesn't mean it doesn't need to be done in a timely fashion, but it just means that patients are stable enough to wait a week or a month or a day in some cases. So having all of our elective procedures postponed, and for some of it was postponed indefinitely overnight, was a very difficult time for not just the patients and their families, but also the healthcare providers, nurses, doctors, allied healthcare professionals who care for those patients. You know, during COVID, the stress of the healthcare system, the pressures we were under, having to forcibly redeploy people to clinical areas which were out of their comfort zone, it resulted in a lot of people stepping back from healthcare as a profession. We do need to be very cognizant of providing people with a healthy work environment when we're recruiting. We've been fairly fortunate in the cardiology portfolio at St. Mary's that we have been able to get back to over 80% of our pre-COVID volumes, but we're still doing 2 cases less per week than we did in 2018-2019 fiscal year. We still have some of the more favorable wait times for cardiovascular services in the province, and we're very proud of the work that our teams have done to decrease the backlog in the cardiovascular realm. Diagnostic imaging was really greatly affected as well, and the wait times for elective CTs and MRIs is still quite long. Hopefully, the onboarding of our new MRI at St. Mary's, which was supported through innovation or initiatives like Red Day and our partnership with Manulife, that's coming online next year, will help with that. I would encourage anybody to consider any avenue in healthcare. It is a tremendously rewarding environment to work within. To be able to see the change that you can affect in people's lives for them and their families is it's a daily joy for anybody who works in healthcare. Will I say that it's an easy industry to work in? It's not, but I think that one good thing that's coming out of the COVID pandemic and the crisis that ensued is that we did shine a light on the fact that we need to look hard at how we provide healthcare, how we support our healthcare workers, and how we make it better for both patients and staff moving forward.